Swayam Prabha. Digital India. Educated India.
Welcome to the course Therapeutic Nutrition. This is a sixth module that is Nutritional Management of Food Allergy and Intolerances. And this is a second lecture in which we shall be studying about Nutritional Management of Food Allergy and Intolerance. I am Dr. Jaspreet Kaur, presently working as Assistant Professor in Government College for Girls, Ludhiana, Punjab, affiliated to Punjab University, Chandigarh. And this project is funded by DTH Swayam Prabha, MHRD, New Delhi. In the previous lecture, we had studied about what are allergic reactions. Then we studied the classification of various immune reactions. Then we studied what are the different types of food allergies. And lastly, we studied about clinical features of food allergy. So in this lecture, we shall be studying about what are the common food allergens. Then we will study what are the causes of allergic reactions. Then we will study the concept of food intolerance and how it is different from food allergy. Then we will study about the various factors which are responsible and what are the symptoms of food intolerance. And lastly, we will study about management of allergy and intolerance. So what are the common foods which are associated with the allergy? The first is egg. Second, it could be cow's milk. And along with that, peanuts and wheat, then soy and fish. They cause allergy in children. So, and along with that, walnuts, almonds, then shellfish such as shrimps or crabfish or lobster, they cause allergic reactions in adults also. So now let us see what are the causes of all these allergic reactions. So these allergic reactions could be of two types. They could be, one thing is food and second thing would be internal environment of the body. So when we talk about food, there could be some common food allergens which can affect majority of persons. And these foods are especially usually high protein content foods such as egg and milk. And it could be of usually plant and marine origin such as seafood. And when we talk about the internal environment of the body, so here heredity of a person, then atopy of person, then antigen exposure, then gastrointestinal tract permeability, amount of antigen presented to the body, and certain environmental factors, they are contributing factors. Now let us discuss all these causes. So let us discuss all these risk factors which cause development of food allergy. We have studied that the first and foremost thing is exposure of the food that acts as antigen or some element of the food which would be an allergen to that person, and that is usually a protein only. And along with that, we studied that the heredity is thought to play a major role in development of atopic disease. So what is this atopy? Atopy, it refers to an individual who is prone to develop allergies because of a genetic state of hyper responsiveness to the allergen. He is genetically designed to react hyper responsively to the allergens. And thirdly, gastrointestinal permeability. It may allow antigen penetration and presentation to the lymphocytes. And gestational permeability, it is greatest in the early infancy and it declines with the intestinal maturation. That is why children, they develop more allergies. And other conditions are there such as gastrointestinal diseases, such as malabsorption, or there could be prematurity, and then immunodeficiency state. It can also be associated with the increased permeability and risk of developing food allergies. And then environmental factors, which include, say, early exposure to the microbes, to the tobacco, smoke, or exercise, or cold environment. And it is important to note that the allergies are most likely to affect the babies and young children because of their underdeveloped immune system. So now let us talk about food intolerance. It occurs when a food component irritates a person's digestive system, or when the person is unable to properly digest or break down the food. It is non-allergic hypersensitivity which occurs for variety of reasons. So we had discussed about allergic hypersensitivity earlier. Now let us talk about non-allergic hypersensitivity. So what is food intolerance and how does it differ from food allergy? Food intolerance, like food allergy, it is an adverse reaction to food. That is the one common thing which they have. But it is different from the food allergy in a sense that it does not involve body's immune system. In fact, food intolerance is a digestive system response rather than immune system response. It occurs when a food component irritates the person's digestive system, or when a person is unable to properly digest or break down that type of food. The triggers to the intolerance could be a number of reasons. We know it is triggered by physical reaction to a food, or it could be a reaction to food additive, or it could be caused by a metabolic reaction to an enzyme deficiency. It can be because of pharmacologic agents which are present in the food. It could be because of a reaction to the food poisoning. It could be a food idiosyncrasy. It is different from the food allergy, which we studied in the last lecture also, where a specific person's body, for whatever reason, that acts against a certain food. So here, most likely the causes are food intolerances. That means the body is not able to process the food nicely, or excessive consumption of certain food can also trigger food intolerance. So let us talk about certain factors which can actually contribute to the food intolerance. In some cases, as with lactose intolerance, the person lacks the chemicals. We call them enzymes, which are necessary to properly digest certain proteins which are found in that specific food. And along with that, some type of intolerance could be because of some chemical ingredients which are added to the food to provide color, to enhance taste, and protect against the growth of the bacteria. So these ingredients, they provide certain kind of benefits, such as they could be flavor enhancers, or they can be any kind of dyes to give good color to the food. So let us discuss all these factors in detail. Enzyme deficiency and defect could be one reason. When the digestive system malfunctions and the body is either not able to digest any food, or there is some problem related to the processing of the food, it will not be absorbed, and the body, therefore, it will react against the undigested food particles. Secondly, it could be because of naturally occurring food chemicals. We call it pharmacological effects. Now, pharmacologically active substances, they include certain vasoactive amines such as histamine, tyramine, tryptamine, phenylalanine, and serotonin. Now, these substances, they are present naturally in many foods, and they are produced during fermentation, cooking, aging, and storage in some other foods. So these substances which cause a reaction, it is just like an allergic reaction. For example, Histamine, it can reach high level in cheese, in some wines, and certain kind of fish such as tuna or mackerel. And these substances may also be consumed in foods such as certain kind of fermented foods such as pork sausages, canned tuna, and then along with that brewer's yeast, canned fish, etc. And in susceptible people, these foods can trigger urticaria, facial flushing could occur, decreased blood pressure can occur, and they might experience headache also. And further, certain foods such as irritants, they can trigger histamine release from the intestinal immune cells, particularly if they are taken in the large quantities. Some common substances are caffeine, which is found in tea, coffee, chocolate, and cola drinks. So a large intake of caffeine, it can cause tremors, migraine, and palpitations. And other irritant substances, they include lecithin in legumes, then paprika, that is chili, pepper, acidic foods, and alcohol. They can all cause certain food intolerances. Certain food additives, such as preservatives, flavor enhancers, or coloring agents, they have been linked to adverse food reactions. So these additives are such as tetrazine. It is a yellow color of dye which is used in foods and soft drinks and certain medicines. Then along with that, benzoic acid or sodium benzoate, which is added to the soft drinks and some cheeses also. In some processed items also we use that. It will cause hives and rash and asthma in people who are intolerant to it. And along with that, it could be because of sulfite. Sulfites, they are group of sulfite based compounds that can occur naturally in certain foods, or they may be added to food to enhance its flavor and for the preservation purposes also. So they are added to many foods and beverages to prevent the browning and to enhance its color and to prevent the microbial growth and modify the texture. And they cause severe reactions such as they can cause acute asthma, they can cause anaphylaxia, and a person may lose his consciousness also. And MSG, monosodium glutamate, we have already discussed. It is safe for many of people, but some people, they get adverse reaction of this flavoring agent, which includes headache, it can cause nausea, flushing could happen, and then abdominal pain, and some may experience asthma also. Reaction to microbial contamination can also cause food intolerance. Now, many fishes, they contain bacteria in their intestine, which they break down into a protein that is known as histidine in the tissue. And if the fish is not immediately used and properly stored, it will release certain histamines. And if these histamines are present in the higher concentration, the person will be at risk for food intoxication also. But if the person takes it in moderate level, so it may lead to food intolerance. Then, along with that, food indigestibility. Certain food components, when they are ingested in the large amount, they are not digested properly, and they end up in the large intestine where bacteria they will feed on them, and this can lead to bloating, flatulence, and diarrhea. The examples of such foods, they are fructose, xylitol, sorbitol, cellulose, hemicellulose, lignin, gums, etc. So all these things, they can cause food indigestibility, and this can cause food intolerance. And certain psychological reactions are also cause of food intolerance, and they have a special psychological trigger. So any unpleasant event in one's life, which is usually during the childhood, when it is attached to eating a particular kind of food, so eating that food years later, even as an adult, it is associated with a rush of unpleasant sensation and reactions. Those symptoms, they may be precipitated by any kind of food. So whenever we are psychologically disturbed, And many are people who are eating some food naturally, whenever they are psychologically disturbed, they become intolerant to that very food. The food intolerance reactions, they may be quite similar to what we saw in case of food allergy. That is why people tend to confuse between food allergy and food intolerance. So the common symptoms associated with the food intolerance are the skin rashes, such as swelling could be there, or it could be urticaria. It could affect the airways, where the person may get asthma or stuffy or runny nose, or he could catch frequent colds and infections. It can affect the gastrointestinal tract of the person, where the person may experience irritable bowel symptoms. It could be colic, or there could be bloating. He could get frequent diarrhea, or he could get vomiting, and frequent mouth ulcers, they can also happen. And along with that, reflux could be there. And in among children, bedwetting is again a sign of this intolerance. It can affect the central nervous system also. It can cause migraines, headache, anxiety, depression, and lethargy, and along with that, impairment of memory and concentration can happen. It can cause panic attacks, irritability among the food intolerant person. He may be little restless, and there could be inattention. He could have difficulty in sleeping, and he could be quite restless where his legs are not comfortable and they are aching. There could be mood swings also. So let us talk about management of food intolerance. The symptoms of food intolerance can come and go, and they change throughout life. Since the symptoms of food intolerance can be mistaken for those of food allergy, so it is very important that a physician and a dietitian, they have a very crucial role in this case. Being able to determine what the person is experiencing, as whether it is food allergy or it is a food intolerance, it is important to see what will be the course of treatment. So the management and prevention will involve three aspects. So what are these three aspects? The first one is diagnosis of the problem. Here, we would see what is the history of the person. Then physical examination can be helpful. Along with that, food and symptom diary, it can be of great use. Then along with that, biochemical and immunological tests, they are also carried out to ensure that the person is food intolerant or allergic. And along with that, food elimination method that we will discuss in coming slides. And coming to the nutritional management, here after the food elimination test has been done, reintroduction of food by food challenge method, it is really helpful in this case. And along with that, nutritional management involves avoidance of the food allergens, because if the person is allergic to some food, he has to eliminate the food entirely from his diet. But if the person is intolerant, he can take the food according to his level of adjustment, whether he needs to eliminate or he can take the food in limited quantities. And along with that, nutritional management will involve provision of some alternate food, because once we are eliminating one kind of food, many kind of deficiencies, they are bound to come. So how to change and provide that same nutrient from the alternate food, that is a part of nutritional management of allergy and intolerance. And after that, if the nutritional management alone is not successful and the patient has developed severe allergies, then these persons, they are put on medical treatment where they can go for some antihistamines, or along with that, for some serious cases, acute cases, epinephrine injections, they are given. Diagnosis of food allergy, it is a very complex process. It involves identification of suspected food, then proof that the food causes an adverse response, and thirdly, to verify that there is immunologic involvement of the same food. So let us see what is the method to identify the suspected food. So this is the first step to know whether the food is a suspected allergen. And for that, we keep a food and symptom diary for a week. And what is to be documented in that diary? We document firstly the description of the symptoms, and then secondly the time of food ingestion relative to the onset of symptoms, when he took certain amount of food and when, after how many minutes or how many hours he developed the symptoms. And along with that, thirdly, we will see the description of most recent reaction. What was the latest reaction he had experienced? And then we will list all the suspected foods, what the person has eaten in 1 week. And then when, along with that, it is important that we estimate the quantity of each food ingested to know whether the person is allergic or intolerant to certain food. Second thing is proof that the food causes an adverse response. For that, to confirm the immunoglobulin E mediated allergic reactions, because we have already studied in the previous lecture that for all these allergic reactions, the most important or the typical ones are which are mediated by immunoglobulin E. So along with that, eliminating the food from the diet and see whether the symptoms they are disappearing. For example, if a person is having peanut allergy, so we have to confirm that it is the same food which is inducing this allergic reaction. We will eliminate that food from the diet and we will see whether he is experiencing those symptoms or the symptoms they have faded. If the adverse reaction is not severe, the food will be reintroduced again. So in that case, peanuts will be reintroduced again and we will then note the symptoms. So how we go about the elimination diets? It is a diet in which either one or more suspected foods they are eliminated depending upon the medical and diet history recorded. The person tells us that he is eating this much of food and these are the common food items he's been eating and these are the common allergic reactions which he is experiencing. So the suspected food or allergen which we have recorded from his medical and diet history, that will be removed from the diet. Now, suspected food allergen, it has to be removed in all the forms which are present. If even if it is cooked or raw, or it could be coming from some food item which has been used. Say that protein has been used. Say if there is egg allergy, so all the products which may contain egg, it could be there in the bakery items. So we have to be very carefully selecting to exclude the suspected food allergen from the diet of that person. And then if the culprit is known, if we know there is only one food which is causing allergy, it will cause immediate type food reaction. So here the only one culprit food is to be eliminated and we need not restrict many food items. But when it comes to delayed type food reactions, that means the person, we do not know what is the exact cause, what is the exact food involved in that. So multiple food items, they may have to be eliminated. And elimination diet could be of three types. It could be mild, it could be strict, or it could be severe. Now let us see what is this mild elimination diet. Mild elimination diet is quite an easier one to do and it is more practical also because here we know what are the causative food items which could be causing allergy. And here one or two suspected items they are eliminated from the diet of a person and after a certain period of time we will be able to know whether these things they are causing allergy. In the strict elimination diet, here we have to eliminate multiple suspected items. And in this case, we have to ensure that the frequently eaten items, they are replaced by the rarely eaten items so that we can come to know and identify what are the possible allergens. And coming to the severe elimination diet, it is a most difficult diet and it is not that practical also. So what is followed in this severe elimination diet? The person here, he is on elemental diet and that is a formula diet, and one item is added at one time in the diet of that person, and we have to keep on adding the various food items, and reoccurrence of symptoms after adding a particular food, that will help us in identifying that this is the actual allergen in that case. So what is food challenge? This is the next step. This is basically the reintroduction of the food. So that is to be followed only after the symptoms of the person they have subsided. And we have to ensure that patient is not taking any antihistamines or any medication to control the allergic reactions. It is actually helpful for patients who have history of life-threatening reactions to the food items, so that we do not add or any kind of food item which could actually flare up the immunoglobulin E, and it can cause sensitization of IgE. So how do we go about it? The test dose of the suspected food is reintroduced in this case. We will observe the response of the person. Then we will evaluate the severity of the symptoms. If there is negative response, that means the person is not allergic to this food, and next suspected food is challenged to see, say for example, we just wanted to know whether a person is allergic to peanuts or he's allergic to eggs. So firstly we eliminated egg and peanut. We introduced only peanut and observed. If the person is having negative response, that means he's not allergic to peanuts. So the next suspected food is egg. Now we will challenge the egg. If the patient is giving positive response, that means he is relieved of his symptoms. That means peanuts, they are the real culprit, and the food allergen is that is the peanuts, they are to be avoided. And the culprit food, it is given in the increasing amount also. So many a time if we are giving food in smaller doses, it may not show the symptoms. So here we will be increasing the amount every 15 to 60 minutes. So what is the test doses? Basically 6 to 10 gram of dry food or 80 milliliter of liquid is given. So let's summarize what we have studied in this lecture. We had studied about some common allergens. They are eggs, cow's milk, peanut, wheat, soy, and fish. They cause most of the allergic reactions in the children. And then we studied that peanuts, walnuts, all almonds, fish, and shellfish, they cause most of the allergic reaction in adults. Then we studied what are the various causes of allergic reactions. We studied that food intolerance occurs when a food component irritates a person's digestive system, or when a person is unable to properly digest or break down the food item. We also studied that food hypersensitivity reactions, they can either involve immune system. In that case, we call it food allergy. And when it does not involve the immune system, we call it food intolerance. And food intolerance is sometimes confused with or mislabeled as food allergy also. Then we studied about what are the different triggers to the reaction. And then we studied what are the symptoms of food intolerance or food allergy. Then we studied about what should be the diagnosis, nutritional management, and medical management during allergy and food intolerance. Then we studied about different types of elimination diet. We studied them according to based on the severity of the elimination. And then we studied the concept of food challenge, where the eliminated food item is reintroduced in the diet of that person to see whether the food is causing allergy or not. We shall study it further in the next lecture. Thank you.